Welcome to my YouTube channel. Today I will discuss doctor and patient relationship, association between patient and doctor to treat for mates lines together and the reduce his or her surfing. Number 1 point, doctor, a person who is qualified to treat people who are ill, a person who are skilled or specializing in healing arts. Number 3, patient, one who is ill and suffering, a person receiving or registered to the receive medical treatment. Relationship between doctor and patient, association between patient and doctor to treat farmers illness together and reduce his or her the suffering. It is usually related to the clinical event, but it is important to realize association beyond the clinical premise. It is a unique connection built on trust, confidentially, and collaboration. The doctor-patient relationship is a partnership where both parties work together to achieve the optimal health outcomes. Types of the doctor-patient relationship: active passive relationship. Number 1 point. In this point, I will discuss patient participate very little in a relationship. Doctor behaves with the patient as a father would be his child of a few months of the age. Number 2, guided cooperation relationship. Patient can receive or orientation and cooperate in its treatment. Doctor behave like a father in front of teenage son. Number 3, mutual participation relationship. Doctor should discuss with the patient is the management of the disease and anxiety creating the situation. Form of doctor patient relationship. Number 1, default, characterized by a lack of the control in either side, not ideal. Number 2, paternalism characterized by the dominant doctor and passive patient. Number 3, consumerism associate with the reserve with a focusing on the patient right and doctor obligation. Mutually characterized by shared the decision making and is often advocate as the best type of the relationship. Components of the doctor and the patient relationship. First point, knowledge. Knowledge refer to the doctor's knowledge of the patient as well as the patient knowledge of the doctor. Number 2 point, trust. Trust is the foundation of any successful doctor-patient relationship. It involves having the confidence in the doctor experience, judgment, and the commitment to the patient well-being. Respect. Doctor should respect to the patient autonomy, values, and choice, while the patient should be respect doctor's knowledge and the recommendations. Empathy. Empathy is the ability to understand and share the feeling of the another person. Doctor who uh, demonstrate empathy can provide the emotional supports, show the compassion, and create more the positive health care experience for the patient. Communication. Doctor should be actively listen to the patient, provide information in a way that easily understood, and encourage the patient to ask a question of the express conference. Patient and nurse relationship. Nurse, a person trained to cares for sick or infirm, especially in the hospital. Relationship between patient and the nurse. Number 1 point, trust is the foundation of the patient and nurse relationship. Nurse are often a patient first contact at the healthcare facility. When patient have trust in their nursing team, they feel supported, safe, and the confident in their care. That bond lead to the better patient satisfaction and the ultimately better outcomes. Nurse also offer the emotional support and the comfort to the patients. Nurse actively listen to the patient and address their question and clear explanation about their care. Overall, the patient and the nurse relationship is a partnership focused on the promoting the patient health, well-being, and recovery. Phases in a patient and nurse relationship. Pre-interactional phase. Pre-interaction is the initial phase in the phases of the nurse patient relationship. It marks the initial meeting between the client and the and therapist, and forms the foundation for future interactions interaction based on trust and support. Orientation phase. During this phase, you will perform the interaction with the patient, establish boundaries, and explain patient confidently. Working phase. During this phase, the focus is collaboration and active participation in achieving the patient goals. The nurse and the patient work together as team to implement the care plan and the address the patient healthcare needs. Communication and trust are key element in this phase to promote successful outcome. Termination phase. In this phase, the focus on care and the uh, trans, tra- and the transiting the patient to the next phases of their healthcare journey. This phase is important for closure and ensuring the smooth transaction for the patient, doctor, and per medical staff relationship. Collaboration: doctor and the paramedical staff work together as a team. Collaboration on the patient plans. Number two, communication. Effective communication. Doctor, the paramedical staff regularly communicate, exchange information, discuss patient progress, and the coordination care. Respect and trust. Mutual respect and trust important. This relationship. Doctor values expertise, skill of the pre-medical staff, while life the pre-medical staff trust the guidance, the decision of doctor. Role and the responsibilities. Doctor have the primary responsibilities for the diagnosing and treatment patient, while the pre-medical staff teamwork. Doctor and the pre-medical staff coordinate their effort to ensure the seamless care delivery and best possible outcomes for the patient. Conflict resolution: resolving conflict through open the dialogue, active the listening, and the finding common grouped is important for the maintaining harmonious relationship. Patient perspective of the disease or illness. Onset and recognition. The first step when the patient start the experiences the symptoms and the recognize that something is not right with their health. This can be confusing and uncertain time as they try to understand what happening to their body. Emotional impact. Illness often bring about a range of the emotions such as fear, anxiety, frustration, and the sadness. Seeking medical help. Patient typically the seek medical assistance to understand their spontaneous and the receive diagnosis. They may the consult healthcare professional, test and the explore treatment option. Doctor views of the disease and the patient. In the media field, doctor generally view disease the condition of the dysfunction that affect the body normal functioning. When it come to the patient, doctor aim to provide the personalized care and treat them the individual with the unique needs. Doctors strive to the establish a strong doctor and the patient relationship based on the trust, empathy, and communication. They listen to the patient concern, involve them decision making and provide information to help them make informed the choice about their health care.